Good afternoon, Akunti Agrawal. Good afternoon to all of you. So last time we started the revision. We started the lesson first aid and home remedies. You know that total 9 lessons are there in our final exam that is going to start from 25th of this month. We started the revision and in last video we have completed about cuts and wounds, burns, nose bleed and animal bite. Now first question for all of you, please write answer in chat box. Please write answer in chat box. Which disease is caused? Which disease is caused by animal bite? Which disease is caused by animal bite? Write down the answer in the chat box. Okay. So last time we discussed first question, which disease is caused by animal bite such as dog, monkey, cat. Yes. Pratesh has given very correct answer. Virudkar has given correct answer. Lavanya has given correct answer. Rabies. Yes, very correct. You know that rabies is caused due to bite of animals such as monkey, dog, cat, because in their saliva there is the virus known as rhabdovirus, and you know that it causes the disease rabies, which is very fatal. And for that, what is the first aid measures you have to take? Already we discussed last period. We have to wash the affected area with water and soap. And the most important thing is to take the patient towards doctor, because doctor is the right professional to treat him. Okay, so never ever neglect animal bite, because you know that it may result in death of the person. Okay, and we also discussed about one of the symptoms of rabies, that is hydrophobia. What it means? The person starts, the person start. What is the meaning of that word? Hydrophobia. It is one of the symptoms of rabies. He is afraid of water. Yes, fear of water. Akunti Agrawal has written very correct. Fear of water. So last time we discussed about the burns. Also we discussed about nosebleed and we discussed about cuts and wound. Now today we are going to discuss about snake bite. Okay. Now you know that in India, I am talking about India, only 4 species, I am talking about India, only 4 species are poisonous in India, that is cobra, crate, russell, viper and sausage viper. Okay, so only 4 species are poisonous, but most of the time what happens, other species, most of these species are not poisonous. But whenever snake bites, what we think it is poisonous snake. And what happens, many people they die due to fear, due to heart attack. Okay, so they think that it is the poisonous snake. But very important thing is that in India only these 4 species are poisonous: cobra, red russell, sausage viper, and russell viper. Other species they are non-poisonous. So first of all, very important thing is don't get panic, keep cool, and you know that you this it is very important to take the patient towards doctor. One Hindi proverb is very famous that lohe ko loha hi katta hai. In the same manner, the treatment of this poison which is released by these snakes, such as poisonous snakes, such as cobra, snake, russell viper, a sausage viper, it is released through the hollow tip are there. Two hollow tips are there which is having opening at its end. These teeth, they are known as fangs. They are called fangs. So whenever these snakes they bite, they release this, they secrete, they release this venom, they release this poison inside the bloodstream, isn't it? So we will find that may result in death of the person if not treated immediately. What is the treatment that doctors know he is the right professional, and you know that it is cobra, you know that, or what is it is written? Yes, anti-venom injection is there. Yes, what Vidya Borpute has written, like python. Python, beta, python is ajgar. Python is non-poisonous snake. Python, what he will do? He will suffocate the patient. Suffocate the victim. He will wind around the victim and he will suffocate the victim and he will kill it and then he will swallow that python kill, it will swallow the victim. Python, it is non-poisonous snake, isn't it? Okay, and cobra you know very well, very common in our colony. Okay, so we will find that you know that this antique whatever that is made from its venom only, its poison only. So we will find this doctor is take the patient towards the doctor because he is the right professional to treat the patient, and do not you know that many people are there that I will not talk that many people you might have seen in movies and all that they are sucking the blood and spitting. Okay, all these things are wrong. So first of all, we should not move the affected area and we should take that patient towards the doctor. Okay, that is very important. Now, different types of poisons are there. You know that in cobra, the poison is there that is neurotoxic. It will affect our nervous system, that is brain, spinal cord and nerves. Okay, and in different species we will find this venom which is present may affect the different. For example, in brain it affects our respiratory system. Okay. Then the next one, that is fractures. The next one is fracture, but before that I will ask you four questions. Name the four species of poisonous snake in India. Write down the answer in the chat box. Name the four species of poisonous snake in India. Write down the answer in your chat box. Four species of poisonous snake. Yes, Vidya Borpute has written cobra. Okay, next crate. Then what? I just told Russell viper and saw-scaled viper. Crate, cobra, Russell viper and saw-scaled viper. Okay, now tell me the medicine for this. It is made from dash. The anti-venom injection, that is antidote. It is made from the dash. It is made from the dash. It is made from the poison of that snake, isn't it? Okay. What do we call the hollow tip? Two hollow tips, which is having the opening through which these snakes they release this poison inside our body. What do we call two hollow tip, which is having opening at its tip through which this snake release their. Yes, Akruti Agarwal has no correct answer. That has given correct answer. That are known as fangs. That are called fangs. Okay. So this is regarding your snake bite. Now, if the bite is on the leg, if the snake bites on the leg, to avoid movement of this leg, what we should do? To avoid movement of the leg. Yes, Dixit has written very correct, beta. Poisonous glands are there which stores the poison. They are connected with the fangs. Very correct. So you know that if the snake bites on the leg, to avoid the movement in the leg, what we should do? Yes, very correct. Vijay Bogude has written very correct that tie long sticks to the leg. Tie long sticks to the leg if stick bites to the leg. Why? To avoid movement of the leg. Okay. Then the best thing I already told you on snake bite, keep the area still. Do not move the area. That is the best thing. Okay. And if the bite is on the arm, what you can do to keep this arm still? Because when you walk like this, there is movement. There will be the movement. What we should do? On legs also, when I am walking, there will be the movement. You know that you have to keep the area still. So tie the long stick here. That we already discussed. But if on the arm, it is there. To keep the area still, what I should do? Put the arm in a sling bandage. Put the arm, whenever fracture is there, we are keeping the arm in the sling bandage. What is the purpose? To minimize the movement of the arm. In the same manner, whenever snake bites, we have to keep that affected area still. Now here we are tying the long sticks to the leg so that it will not move. And here better keep it under the sling. Now the most important thing is to take the patient towards doctor. Very fast. Okay, that is the most important thing that we have to do regarding snake bite. Yes, what Vitholia has written very correct. Put the arm in sling bandage. Okay, and if it is on the leg, tie the long stick to the leg. And the purpose is not to move the area. Okay, not to move the affected area. That is very important in case of snake bite. First of all, keep cool, because it is not 100% sure that only it is poisonous snake. It may be non-poisonous snake. Okay, but some people may die due to heart attack. अरे कोबरा ने काट दिया, बस अटैक आ जाएगा, मर जाएगा. तो first thing what we have to do, keep cool, calm, quiet. Don't move the affected area. Rush to the hospital. Okay, and in every hospital that injections are there, injections are there. Okay, so the doctor, he will do his work. Okay, so don't go to the nearest hospital as soon as possible. Yes, Mithole has written very correct. Okay, very good, beta. Don't panic. Dixit has written very correct. Very good, beta. Okay. Yes. Sling bandage. Ambedkar has written very correct. If it is a snake bites on hand, keep it under the sling with bandage. Okay. Don't panic. Pratyaksh has written don't panic. Very correct, beta. Okay. So then we have to leave until the ambulance. Yes. So these steps you have to take in case of snake bite. Okay, you might have seen that in Discovery Channel many such cases you might have seen, they show live, or so it is not that now that medical science is too much advanced, and the person, we can save the life of the person if he is taken towards the doctor immediately. Then the next one, that is fractures and sprains. Now you know that fractures also, the first most important thing in fractures also, do not minimize the movement of the affected area. You know that you are playing on the ground, running on the ground, or fall down, fracture may be there on the hand or in the legs, whatever part it may be. But the most important thing is, what is this fracture? A fracture is a crack in the bone, okay, or a breakage of bone. That is called fracture. So what you have to do in case of fracture, when you fall, we will find in case of fracture also, you should not move the affected area. You should take the patient towards doctor. Sling you can, if the hand is fractured, then you keep the hand, the sling made from this bandage. And also there is another word, sprain. Sprain, fracture and sprain. Sprain. Yes, Aputi Agarwal has written very correct. Use sling bandage if there is any fracture in the hand, because it will minimize the movement of the bone. Okay, what Nitu Singh has written, the bones, the cracks in the bone is called fracture. Okay, it is what Bicole has written, it is best not to move the affected area. Okay, correct. Then the next one, that is, you know that, yes, Aputi Agarwal has written very correct, injury in the muscles near the joint. Okay, it is sprain. You know that our body, it is made up of, how many bones are there in our body? In our body there are 206 bones are there. And there are these, you know that this bone, one bone is joined to the another bone by ligament. Okay, bone is joined to the bone by ligament, and bone is joined to the muscles by tendon. Okay, 206 bones are there, and when we take birth, there are more than 300 bones are there. But as we grow, what happens? These some bones they fuse, and in adult we will find 206 bones are there. And you know that our movement is possible only due to these bones and muscles. Okay, so you know that if the joint is also, this bone is joined to the another bone by ligament, muscles. Okay, and bone is joined to the muscles by tendon. So while moving, while running, sometimes what happens at joints? At joints, we will find sprain occurs. Okay, so sprain, it's a very painful. Like that, we will find fracture is also very painful. So a sprain is an injury to the muscle near a joint. So whatever it may be, we will find, make the person sit or lie down as comfortably as possible. Do not allow him to move that area, because if you will move that area, you know that the brain may get dislocated. Okay, it will dislocate the brain. So this bone. So it is very important that you should not move the affected area. You can support the injured area with cushion or pillow while you wait for the help. Okay, so here Labar's decoded. We have to make what Pramod has written very correct, Dixit has written very correct. We have to make the person lie, and we have to call the ambulance. We have to make the person lie, or we we have to make the person sit or lie, and we have to call the ambulance. Do not move the affected area. Okay, so these are the first aid measures in case of fractures and sprain. Now the things, that first aid box. First aid box, that you need first aid box during such emergency conditions. We will find doctors are not available and you want to minimize the pain, you want to minimize the injury. Okay, so what you need, all the things what we require at that point. So that all we will find it is kept in the first aid box. Now you already made the first aid box. Now this first aid box, what are the things are there in the first aid box? First aid box, what are the things are there in the first aid box? Yes, one by one write down things in the first aid box. What are the things there in the first aid box? First aid box I am speaking about. First aid box. Yes, Akriti Agarwal has written antiseptic lotion, antiseptic ointment, sterile gauze, cotton, band-aid, antiseptic lotion. Yes, all these things are there. Like scissors are there, tweezers are there, and you can keep some clean clothes also. Okay, sticking tape, band-aid, sterile gauze, baking soda, calamine solution. Okay, so antiseptic lotion and cream already you wrote. All these things should be there in a box. That is the first aid box. I already told you to make. Hope all of you have made it, and all of you are keeping it at home for such emergency condition. For example, if there is burn cut in the kitchen, so immediately what you want after washing, what do you need at that time? At that time you need the antiseptic cream or antiseptic lotion, isn't it? So like that, you have to keep all the things ready in that first aid box. Okay, and along with that, it is also very important. We may neglect, but it is also very, very important thing. That is to make a list of the phone number of a few people you can call for help when you are alone at home. Always keep this phone number ready. So you can call these people immediately when you are alone at home in such condition. We may neglect this, but this is also very important. And you have to stick this list inside the cover of your first aid box. That list should be there, first aid box. So you don't have to search here and there. Where is the list? First aid box is there, and inside that cover you paste that list with all important numbers. Okay, you can write the phone number of local police station also and some hospital which are located nearby. We may neglect, we may ignore all these things, but they are very important because we don't know what will happen, what moment. So it is very important to keep all these phone numbers ready in the stick on the lid, underside of the lid of the first aid box. I already told you the phone number of nearby hospital is very important. Along with it is very important that should have the phone number of local police station. Okay. So triangular bandages, yes. Urmila, what is correct? Very correct. Triangular bandages also very important. So all these things. Mithole has written calamine solution, Bernol, band-aid, sterile gauze, antiseptic lotion like Dettol, Savlon, all these things, it should be included inside the first aid box because you never know that when You need all these things immediately. So keep it ready. Yes, Virudkar has written scissors. Okay, scissors. All these things are very very important. And the most important thing that in any emergency situation, it is very important for children not to panic. Okay, so and also we know that we practice the steps to be taken in such cases. We have, for example, mock drill. Mock drill we are doing here for earthquake. Mock drill we are doing here our school for fire. Okay, so like that you know that for each and every situation, for example, choking is there. You have to do practice for that because you don't know when such situation occurs. So at that situation, instead of getting panic, what to do? That what to do means what? Instead of that, you first thing you should understand about this is to keep cool and to so in advance you should practice all these steps to be taken in such emergency conditions such as choking or suppose someone catches fire. Okay, so it is already 1:30. So what we studied today? Today we studied that snake bite. In case of snake bite, first in India, only 4 species of the snakes are poisonous: cobra, crane, Russell viper, saw-scale viper. Second step, most of the people when snake bite, they think that it is a poisonous snake and they are going to die. So they die of fear, heart attack. Third thing, we should remember that whatever, don't do the area. Keep the affected area still. If it is there, right on the hand, keep it under the skin. Wait with the bandage. If it is on the leg, tie a long stick to it. Immediately, within seconds, minutes, rush towards the doctor. No time to rest. Okay, so that is the most important thing in case of snake. Nobody can treat unless you know the doctor is the right professional. He knows what to do, which antidote he has to give. Okay, he knows very well. He can identify the marks. He can identify the species also. They are trained. They study for 15 hours. Okay, 5 years, so many years they study. So they are a quite trained person and becoming a doctor is not a joke. First cracking NEET is not a joke. For cracking NEET only 10th, 11th, 12th, 3-4 years, you have to study 15 hours per day and night. And after that also people they don't crack. Because this cracking is not just cracking, it is among lakhs you have to come in hundreds, few hundreds first. In that position you have to come. So you know that these professionals, doctors, they are very intelligent people and they are right person to treat the patient because they can identify the state by seeing the mark also. Mark of the fact. Okay, so they are the right person. So immediately without moving the area, if you move the person towards the doctor, he can save life. Okay, so thank you. Have a nice day. Enjoy your studies. So I will stop here.